Please join me in welcoming Kandy Hammond. Okay, again, I want to thank everybody for coming. I do appreciate all of you being here and the support that you are giving this meeting. So I'm going to take off from where Dr. Bush left and tell you a little bit how I got to where I am today. And as you, I'm sure all of you know, that I've been with him working with him for 18 and a half years now. So quite a long time. And it really started, as I said, 18 years ago in the halls of the hospital. I was working in the ICU, surgical ICU, and he walked down. Actually, he didn't walk down. He had ruptured his Achilles, and he was on crutches, and so he hobbled down the hall and said, "Hey, I'm going to start doing a vein day. Would you want to work for me one day a week?" And I said, "Sure. What's one day?" I've only worked in 312s, and so one day seemed to be reasonable to do. So he said, "Well, come over tomorrow, and we'll, see if you like it, and just do a day." So I said, "Okay." So I went in, and lo and behold, we're doing a surgery. Now, I know all about sterile technique, but I am not an OR nurse. And so I draped the patient, and I did all these nice things. And he walks in, and we start doing, a little phlebectomy, and he says, "I'll have the DeBakey's." And I said, "Look, you got hemostats, you got scissors, and you got tweezer-looking things." And he said, "I will have the tweezer-looking things." And I said, "Okay." So then I'm thinking he's either going to fire me now and say, it's really not going to work because you don't know anything about surgery, or it's going to work. And obviously it worked. And I used to tease him all the time, "Let me be your scrub nurse." And he's like, "No, I want to keep you in the ICU. And I told him I would be your best scrub nurse ever if you just let me do this. And so I guess he must think I turned out okay. So 18 years later, here we are. So I met Bill back at the IVC this year, and we started talking. And we were talking about, some needs of the private practice, and I was saying, office managers really kind of get neglected in a lot of these meetings. We talk about the clinical stuff. The IVC is now starting to put some business type things on, and I know this year Sunday is all dedicated to that, and I think that's great. But really, a lot of the office managers, and a lot of physicians are their own office managers, but they're neglected a little bit. We don't talk about these things and how you can really help your practice. So as we got talking, all these things that are in my head, when I go in, I'm like, okay, we're dealing with marketing, we're dealing with this. He's been able to take all of these kind of parts and help bring them into a model that we believe is going to be repeatable. So when we come in, we're going to be able to say, these are the things you need to do, these are the steps you need to do, and in order to make you have the best, most productive practice. And with that, I guess I'll go back. I am going to let Deborah introduce Bill.